This week's assessment will be the skin, hair, nails, and lymphatic system. Okay. Beginning with the skin assessment, we have already taken a pertinent health history, his family history, allergies, eczema, melanoma, and his history of skin sensitivities, sun exposure, itching, rashes, moles, dry skin, lesions, care of the skin and nails, and any products and appliances. First, we're going to inspect the skin for uniformity, odors, color, skin symmetry, hygiene, rashes, bruises, lesions, and scars. And that'll be an overall assessment. Then you're going to palpate the skin. You're going to palpate the skin in several areas for moisture, texture, temperature. You're going to check skin turgor. You can do an arm or that's fine. Any lesions, thickness, mobility. Inspect and palpate the nails for color and blanching. You can do cap refill at this point. Any clubbing, any splitting or deformities, ridging, beading, peeling. Check the angle for clubbing. Can you do like that? Look at the angle. Okay. And then inspect and palpate hair for color, distribution, quantity, texture, and parasites on the head and body. And also on the nails, you can look at the folds for redness, swelling, pain, exudate, warts, cysts, and tumors. Check the texture and firmness, the thickness, uniformity, and the adherence to the nail bed. Abnormalities of the skin include inflammatory and infectious abnormalities, eczematous dermatitis, folliculitis, furuncles, cellulitis, tinea, pityriasis, rosea, psoriasis, rosacea, herpes zoster, and herpes simplex. Cutaneous reactions include drug eruptions, anthosis nigrans. Biologic warfare are anthrax and smallpox. Malignant and neoplastic abnormalities include basal cell carcinoma, squamous cell carcinoma, malignant melanoma, and Kaposi sarcoma. Hair abnormalities are alopecia areata, scarring alopecia, traction alopecia, and hirsutism. Nail infections include paronychia and onychomycosis. Nail injuries can be ingrown nails, subungual hematomas, leukodystrophy punctata, median nail dystrophy, and onycholysis. And then nail diseases are koilinchia, bowlines, white banding, psoriasis, and growths can have warts, digital mucus cysts. Pregnancy, you can see pruritic urticarial papules and plaques of pregnancy, or PUPPP, and herpes gestationis. Infants and children, you can see seborrheic dermatitis, miliaria, impetigo, acne vulgaris, chickenpox, measles, German measles, hair pulling or signs of abuse, and the older adult can have stasis dermatitis, solar keratosis, or signs of abuse. Assessment of the head, neck, and lymphatic system. Also, again, obtain a pertinent history, and you'll be looking at the lymphatic system for swollen nodes, swelling of extremities, malignancies, immune disorders, and infections. And at the head and neck, injury or trauma to the head, headaches, stiffness, pain, swelling of the neck, difficulty swallowing, or thyroid disorders. First, inspect the head and palpate the head for the size and shape to see that the head size and shape is normocephalic. Symmetry and symmetrical movements of the face, any nodules or lesions, Inspect and palpate the neck for range of motion in flexion, hyperextension, and rotation. Can you move your head and rotate it all the way around? The appearance, swelling, symmetry, lesions, and nodules. Then palpate the neck structures. The trachea should be midline and movable. And the thyroid, shape, size, and smoothness you will feel from behind on the thyroid gland. And you want to auscultate the carotids, checking for thrills and bruits in the thyroid if enlarged. And then palpate the lymph nodes of the head and neck. You want to palpate the preauricular, the postauricular, suboccipital, tonsillar, submaxillary, submental, and the superficial cervicals, the deep cervical, supraclavicular, and you want to look for if they're enlarged, have red streaks or lymphangitis or lymphedema. You want to compare them side to side, consistency, mobility, discrete borders or matting, tenderness or warmth, and abnormalities in the lymphatic system include acute lymphangitis, acute suppurative lymphadenitis, lymphedema, lymphangioma, or cystic hygroma, lymphatic filariasis, which is elephantiasis, non-Hodgkin's lymphoma, Hodgkin's disease, Epstein-Barr virus, mononucleosis, toxoplasmosis, Rosella infantum, herpes simplex, cat scratch disease, AIDS, serum sickness, latex allergy type 4 dermatitis, latex allergy type 1 dermatitis, and reaction. You can also check for the axillary nodes, the inguinal nodes, the popliteal nodes, and spleen nodes.